Platform, starting with the CMO, bringing us up to date on our COVID response situation, and Dr. Hines and Dr. Trotman will give us their reinforcements. Then the Minister will give us his roundup, largely on the vaccine program and so on, where we are, what we're looking forward to there. When that is done, I will then come in and we'll take it from there, and I think we should have quite a clear and clarifying afternoon. So, Dr. Parasam, please, thank you very much.
Thank you, Honorable Prime Minister, Honorable Ministers, colleagues, members of the media, members of the viewing and listening public. So I will give a brief clinical update. Starting with the total number of persons tested, 70,202. I think in the news there you will see an article that outlines this in a little more detail as to why we have decided to include the private test from now on going forward. The total number of private tests included are 30,177. The total positive cases so far, 7,024. Total active, 411. Total recovered patients, 6,488. Number of deaths, 125. And total hospital patients, 24. I won't go into a lot of detail with regards to the update beyond that. It would have been in the 4 p.m. update. Just wanted to touch on one other matter before Dr. Hines comes on, and that is the variant that we have been talking about in the UK. So, as the IHR focal point, I would have received communique from WHO indicating that the variant is called SARS-CoV-VUI 2020-12-1, which indicates a variant under investigation from the 1st of December 2020. So basically it is, in simple terms, a mutation that has occurred with the virus. So there are two major types of mutation. There could be a shift or there could be a drift. A shift is a large change where you have a greater increase in sequencing changing, and we expect that this is actually a shift and not a drift. So the implications for therapeutic treatments as well as vaccines, there are implications. Historically, you would have found when you have shifts occurring that the vaccine efficacy would decrease. However, it's a little too early to say. What is happening from the vaccine, that's the Pfizer vaccine manufacturer's point of view, is that they said they need about 2 weeks. They're doing active research now to figure out what impact the new strain is going to have on the efficacy and the uptake of the vaccine. And then, of course, they will come back with their findings to the world once that research is complete. So I don't want to preempt what they're going to find to say that it is not going to work in the same form or fashion. Let them have the 2 weeks, do the research, and I'm sure they will come back and say what they found at that point in time. With regards to the virulence of the vaccine, nothing has been said. That is how severe it is. There's no significant change or research suggesting that it's changed significantly. And the transmissibility, there have been some claims from certain countries saying that it has increased its transmissibility. I think the research is still out to say whether that is indeed so. And again, we have to wait until that determination is made. There are a lot of confounding factors that seem to be at play in terms of population movement and other things that don't allow us to make that decision or make that determination at this point in time. So I think we have to wait. It's a variation that we have seen predominantly in the UK. It has also been seen in Australia and Denmark and other territories as well. So South Africa, I'll just list them: Australia, Denmark, Italy, Iceland, Netherlands, South Africa has sequenced this new type as well. So Dr. Hines, you could go into your EPI update as well.
Thank you, CMO. Good afternoon to the Honorable Prime Minister, Honorable Ministers, members of the media, viewing and listening public. Afternoon to my colleagues. The EPI update follows on what we've been seeing over the past several months in terms of what we're seeing with the trends in average number of new cases per day on a week-to-week basis. Now, while we are still seeing relatively small numbers day to day, the range that we see those numbers numbers varying between, and the higher and lower numbers, the highs and the lows within that range, are beginning to trend upwards ever so slightly. So what we're seeing is that what we call that rolling 7-day average, whereas it would have been about 15 cases per day 2 weeks ago, we're now seeing it climbing to 18 to 19 cases per day at this point in time, which is not surprising or not unexpected, given that we are having considerably more movement and population mixing and mingling as we come closer and closer to the high point of the festive season. So it's a good opportunity to remind the population that even the little that we think we're doing, the little extra that we think we're doing with our mixing, mingling, going out, is reflecting itself in little, at this time, changes in the average number of cases. But as we continue, if we keep this up, we will see that those little changes may in fact start to become bigger and bigger if we are not careful. So it is the opportunity to remind us all, even as we go into the peak of the festive season, that we can't do that gathering, hanging out, liming that we would like to in the way we would like to, and that we do have to hold the fort, because the virus doesn't take prisoners and it doesn't ignore changes in behavior. What you do reflects in viral transmission. So without going too much more into the epidemiology, the only other things we want to point out is that we're continuing to see cases in the places where we have the densest populations. We're continuing to see that male preponderance among the fatalities. We're continuing to see that people with the pre-existing or what we call comorbid conditions do have worse outcomes, and we definitely want to continue to remind the population, members of the population, that if you start to feel any sort of respiratory symptoms, especially any sort of more severe respiratory symptoms, chest tightness, fatigue, those sorts of things, you don't wait until that gets really bad before you seek care. Once you're feeling respiratory symptoms, you should seek care. If you're feeling shortness of breath, tiredness, anything that's out of the ordinary, worsening any of your routine symptomatology, you should seek care. If you see your blood pressures going out of their normal range, blood sugars, etc., we should seek care. We don't want to leave things to become extreme before we seek the appropriate care, because if we leave things to become extreme, we're not going to have the good outcome that we could have if we seek care early. So I just want to leave that on the table as I turn over to CMO. Turn over to Dr. Trotman.
Thank you, Dr. Hines. Prime Minister, Honorable Minister of Health, CMO, members of the listening public, media, my colleagues. I come in festive colors, but I come with a very serious message. The message is one I feel that I really want the population to take home. We have noticed as the health community that the base upon which we stand is beginning to shake. It's not crumbling, but it's shaking. We know the fundamentals that we must do are very contradictory as a people to who we are. What we have noticed is our 50% capacity in our business places is not being adhered to. It's what I have experienced and other members of the team have experienced. That as we go out to these areas, they are crowded and people are not distancing. Make it your personal responsibility that if you go to those areas, like I do, Minister Young does, CMO does, you're not comfortable, remove yourself from that environment. I take it a step further, and I would bring it to the attention of the people who I think could make a difference for that establishment. You may or may not do that. But you yourself can remove yourself from that type of environment. We're seeing it in the groceries, we're seeing it in the malls, even seeing it in our church places. which is, as you know, areas where spread because of the type of behavior in churches with the singing and so, where we can have spread. Good news is that we are seeing that people are still wearing their masks. And I want to thank you all for that. I really want to praise the population for embracing the mask as our vaccine for now. But it has to be paired with the 3 elements that we talk about. And I mentioned it in press conference on Wednesday. A simple mnemonic for us to take home with us. SDM. Sanitize. When you think about the S and you think about the spirit of Christmas, remember to sanitize. That's the S. When you think about drinking your sorrel and punch creme, that's the D. Remember to distance. And I must say here, not to hug. It's disturbing, but I am seeing people greeting each other with a hug. That's what we do. I know it's hard. It's very, very hard. As I told you, it's breaking my heart not to do certain things just like you, but I'm begging you not to. When you think about the M, you want to be merry, you want to dance, not in a crowd, not with people who don't live with you. Not when you try to time it and come for an hour with 10 people, an hour, another hour with 15 people, and another hour with 20. It doesn't work that way. So when you think about the M and you want to be merry, do so with your own family unit and wearing your masks. S, D, M. We want to look forward next year. We want to take 2020 away, welcome in 2021 with low numbers, so we can move forward with the business of trying to get ahead with our lives. And the way to do that is to sanitize, distance, mask, stay within your own family unit, and don't forget, if you're ill, don't go to work. Have a Merry Christmas, joyous season, and a Happy New Year. Thank you.
Thank you. Thank you very much, Dr. Trotman, Dr. Hines, CMO. I would ask Minister Terrence Dalsing now to give us a little roundup and to brief us on the areas that he thinks we are.
Thank you very much, Honorable Prime Minister, Minister Young, Minister De Norberga, Chief Medical Officer, Dr. Hines, Dr. Trotman, ladies and gentlemen of the media, citizens all where you are listening, Merry Christmas to you. It was on Saturday, 24th October. I remember the date exactly because that's your birthday, Prime Minister. We were in Tobago for one of the press conferences. And I started to alert the country at that time as to a particular statistic, and that is the number of countries around the world that were clocking 1 million cases and above. At that time, there were 7 countries with 1 million cases. That was on Saturday, 24th October. Today, there are now 16 countries with 1 million cases and above. It has more than doubled. And right below those are 2 countries, one on 989,000, which is the Ukraine, and South Africa at 940,000. So when next I give this update, it will move from 17 to 19 countries with 1 million cases and above. The number of average infections per day shows no signs of slowing down. And the reason why I say this, there was a very irresponsible statement made in the Senate last week, where an opposition senator says we are getting the vaccines too late now that the pandemic is starting to decline. Let me debunk that theory. The pandemic is not declining. It is not even leveling off. It is actually accelerating. Today, I want to deal with 2 issues. I'm going to deal with the Parenco issue, but I want to deal with the Parenco issue in the context of protocols and what we have been doing, and also to drill it down to the household level. You would have heard Dr. Trotman speak about the household level. We are getting information now that many people are now planning Christmas limes, and what they are doing, they are splitting up the gathering. So if they are accustomed having 30 or 40 people at home, they are now saying, okay, 10 people come between 9 and 12 for brunch, 10 come between 1 and 3 for lunch, and 10 come between 4 and 9 for dinner. That is just as dangerous as bringing all those people together. So time-lapse liming and partying for Christmas is not advisable. Ladies and gentlemen, at the start of this pandemic, way back in March, the Ministry of Health would have put out its protocols for the different industries, whether it was entertainment, whether it was churches, and we did the same for oil and gas. That was in March of 2020, CMO. There was a meeting in March again with the Ministry of Energy, the Ministry of National Security, and the Ministry of Health, and all the energy companies to reinforce what the protocols should be for the safe operation of the oil and gas industry, because it is our lifeblood. All was going well until the 15th of December. On the 15th of December, we got 2 cases of COVID on the teak platform of the Perenco Oil Company. 3 days later, that exploded to 36 cases on the 19th of December. On the salmon field, we got 1 additional case on the 16th. So that brought the total case count for the Perenco operations up to 39. We did swab all the other areas, and luckily all those other tests came back negative. The point is, the protocols and guidelines, whilst they do not carry the force of law, are there for the safe operations and to ensure business continuity. Whether you're a cinema, a restaurant, a hardware, oil and gas. What we don't want is for business to shut down. Now with this, Perenco is going to have to lose some production capacity. The Ministry of Health would have written the Ministry of Education on the 19th of December. Ministry of Energy on the 19th of December, and copy to my colleague, the Minister of National Security, because he also has to grant exceptions for flights and so on. The union would have written to us on December 22nd, and of course the union should be concerned. We did respond to them on the 23rd, saying basically that we'll be working with the Ministry of Energy. That is the line ministry with oversight for Perenco and the whole oil and gas industry. My reason for raising this is to have a conversation with business in general, not only Perenco, not only BP or Shell, all business, whether you are land-based, energy-based, cinemas, onshore, offshore, that adherence to protocols is just good business at this point in time. It is good business. It is good for your business. The Ministry of Health never took its eyes off of this Perenco issue. On the 22nd, which was yesterday at 7 a.m., decontamination and sanitization started on the Teak Charlie platform. That has continued. What has happened is that hot and cold zones were set up. That is the areas of highest potential for transmission. All bioburden materials, including foodstuffs, linens, pillows, were sanitized. All trash, general trash, were removed from the platforms and taken online for incineration. Air quality testing is being done, and all human touch areas. So what is a human touch area on a rig? Catwalks, where the operators walk, handrails, cranes and hooks, because they touch the hooks and they touch the cranes. Their accommodation, their sleeping accommodation, their recreation accommodation, their control rooms, their utility rooms, all of these are being sanitized, cleaned, so that operations could start back. So the Ministry of Health is highly involved in the Perenco issue, and so far, since the 19th, we have had no other cases. CMO might probably give you some idea of how these people are being treated clinically. They were removed and sent to different facilities. So my closing comment on the Perenco issue to the business community, and we did write a letter to Perenco urging them in a very robust manner that the protocols are to be adhered to, that the protocols should be adhered to. It just makes good business sense. So that is what we are doing with the Perenco issue, and I'm urging all businesses to adhere to the protocols that we set out. Prime Minister did indicate that I'll be talking briefly about vaccines. At Saturday last press conference, I did give a very detailed account of where we are with vaccines. I don't intend to go into that granular detail, save and except to say that under the COVAX facility, there are several candidate vaccines that are being considered. AstraZeneca, one with GlaxoSmithKline, the Moderna, and Johnson & Johnson Janssen candidate, which I would love to get, because that particular one, the Johnson & Johnson Janssen candidate, is just a one-jab vaccine. So that will be, much more easy for us to administer. You will get higher rates of compliance. We met with PAHO again this morning. We meet with PAHO every Monday and Wednesday. There are no new developments from last week, Friday and Saturday to now, as far as vaccines are concerned. We continue to work with the COVAX facility. I did promise last week, Saturday, that the purchase order for more sub-zero freezers will go out by this week. The Deputy Permanent Secretary this morning indicated that that has been done. The tenders to build the 2 to 8 degree chiller at Couva have gone out. The documents have been collected, and a committee to evaluate those tenders will start to meet in early January, as soon as the responses from the 4 or 5 persons or entities who submitted their bids. We hope to have that chiller done and dusted and installed in Couva by the middle of February, with an indication from PAHO that this region, not only Trinidad and Tobago, the region should start to receive its approved vaccinations by around March. So we are in a pretty good place right now. I did indicate on Saturday, just in the rare event that we should get vaccines now, we do have in country right now 3 -72 sub-zero freezers that could be pressed into use, and we do have 2 -20 freezers that could be pressed into use. All that we are missing right now is a chiller in Couva. So, Honorable Prime Minister, that's my global update, the Perenco situation, and the situation on vaccines as we like. Thank you very much, sir.
Thank you, Minister Terence Dale. Since we ended on Perenco, maybe CMO, you might like to indicate how we have gone about handling the population of infected or people at risk in this Perenco situation.
Yeah, so we have worked closely with Perenco since getting the first case. So the first 2 individuals would have been brought out, as Minister said, on the 15th. The other 36 brought out en masse in 2 groups, one of 19, and then the remainder in a second group. They have been put into state supervised or quarantine, which is under the control of the CMOH for the respective area. The negative people from the teak field have also been put into quarantine at the cost of the company in a state supervised facility, and they will be followed and retested as they need be. All the other negative individuals on the salmon and poi platforms will remain on the rig and retested and remain in a state of quarantine until they can be retested in about 7 days or so. Once they're negative, there will be a crew change and they will be allowed to come off. So more or less that's in a nutshell what is happening. They are all, Prime Minister, they're all in fairly good health. There hasn't been any case that needed escalation as yet to a hospital setting.
Thank you very much. This brings us to Christmas week 2020. For me, the government, particularly the Ministry of Health, Ministry of National Security, and I would say the business community, this has been a year of engagement beyond any we have ever had, and one that I don't think we will ever forget. However, we are in a slightly better position now than we were in January. Cast your mind back to January, when we were awaiting the arrival of reports of that virus into the population of Trinidad and Tobago. By the time we got to the end of the first quarter of 2020, we had to take evasive action, and that action was very drastic. We had to shut the country down. And we were looking at a horizon, as advised by our technical and scientific people worldwide, that this situation certainly will take us beyond May and more than likely into September. And there was no question of a vaccine being available then, even though it was seen as one of the ways to deal with the problem as we addressed it. And of course, we had to withdraw our children from school. The one thing that we did not do in Trinidad and Tobago, because COVID or no COVID, blood had to flow in the veins if we were to stay alive. So even with the dire consequences coming to us, without the knowledge of the behavior of the virus that was very patchy at the time, the incubation period, the mortality rates and so on, we kept our energy sector fully open and engaged. We never shut down the energy sector in any aspect. And the Ministry of National Security was responsible for ensuring that the human involvement in that business was managed in such a way that it did not unnecessarily expose the population to this dangerous virus. It involved a lot of contact between the companies, both home and abroad, offshore and onshore, and we semi-isolated our energy population, especially on those platforms, to ensure that our fuel, our gas kept flowing, and that is what was able to keep us through. And so that aspect of our economy was not affected by COVID until you would have heard there. Not surprisingly, we've had a little uptick in an area, because these platforms were viewed as isolation areas, and we try to keep them that way. But people are moving around, and we said from this platform on many occasions, there are two things. You congregate, you come together, people move, and then the chances for infection would improve. When we came back out of the lockdown of April, we said we bring people out slowly in larger numbers, but we also anticipated that that increased population of people moving around would expose us to possibilities. And if, as you listen to the statistics, it appears as though there's a 10% of those who are infected who go on to become problematic, right? And then a smaller percentage of that require hospital care. And we had to keep our eye on our ability to provide that hospital care in the event that any person in the population, whoever that person might be, requires that that hospital care. I can tell you today that we have been largely successful in keeping those zones of management. Hospital numbers, you would have heard what they are. Numbers of infected persons, numbers of recovered persons, a fairly high level of testing both in the public and private sector, and all of our actions with a purpose. And if Dr. Hines had shown you his graph, he would have shown you how we responded to the doubling of the numbers of persons infected when we started wearing the mask, when we made the mask mandatory. We did see a very significant improvement in the extending of the period of time it was taking to double. And had we not done that, we would have been in a much, much worse position today, because the doubling of the numbers of persons infected would have skyrocketed. So on that basis, I want to say to the population that what we have been doing, notwithstanding what some people might say about the inconvenience, because we did admit up front that there would be serious inconveniences, there would be serious disruption, there would be serious costs associated with our actions, but at the end of it, it was the best suite of options to have us where we are today. We're not in the best place to be, but we are in a lot better place than many people who were even determined to have been better off than we were, because we held our lines, and today most of our economy is out to work. The only areas where we are restrictive are some restrictions in the food and service trade, where you're allowed. We came back as far to indoor dining, but at a reduced percentage. We allow outdoor dining. We have our bars still open to sell, but no congregation at the bar. We have our schools still closed. And I said to you 2 conferences ago that what we are trying to target, but targeting after this very uncertain Christmas period, that we're hoping that in 2021, by mid-January, if we are in some similar kind of position to where we are now, without the arrow pointing upwards, we would want to begin to treat with some of our school population. That would be a huge step forward, because we know what is happening with our children not being in school. You would have heard about who's getting laptops and who's getting whatever you call it, the tablets and so on. But that's only one aspect of it. The other main aspect is the absence of interaction among our children. Yesterday I was looking at a report in the United States which was saying that there has been a 31% increase in mental health issues with young people reporting for care. And that is a system where they have a very huge infrastructure to treat with that sort of thing. While we may have some here, we don't have that detailed infrastructure. So we really don't know what's happening to our children. But what we do know is that if we do get some of them back to school, or all of them for that matter, it would be a huge positive step forward. And of course, the rest of our economy, our manufacturing sector, came back out and have done admirably well. I think our manufacturing sector requires an acknowledgement. But again, as we got the better of what could have been the worst, and as we monitor, we are seeing and hearing that some people have been dropping their guard. And as we come into Christmas now, we know that this is a time for that dropping of the guard. And today I want to appeal to all the business community. This might be your best week, I know that. Might be your best week in the year. But don't let it be the week when we would have lost the gains that we have made. Continue to emphasize the sanitization that's supposed to go on. Continue to emphasize the distancing. Continue to emphasize the lack of congregation. We've opened up the shopping for household items for 24 hours. The reason is that we want you to use the full period and therefore diminish the number of persons at any one time. So you could use that. And also the management of these organizations, small shop, big shop, malls and so, the management needs to get involved and ensure for good reason that people don't just do it as they see fit on top of each other's shoulder. Do that spacing of 6 feet apart. Talk, you don't have to be in people's face to shop. The Christmas season is one way you like to be jolly and you're happy and cheering and so, but there's a danger in 2020. In 2020, that being jolly for Christmas is a danger if it involves too much interpersonal reaction. So help in the national effort by shopping in your own space, by keeping the crowds small, right down to the family level. Because what we have taken as our prescription has worked. It's not the Prime Minister. It's not the Minister of National Security. It's not even the CMO. It is the prescriptions that we have taken. And they've worked, so let's not give them up now, because it would be really disappointing if after all that we have done in 2020, that we drop our guard now by trying to relax too much and not being disciplined enough, and then start 2021 from a higher plane of infection than we could have been had we done differently. So that's the appeal I want to make today. And I want to make a special appeal to my fellow Tobagonians and Trinidadians going to Tobago. Trinidadians going to Tobago. It is not a free-up zone. It is not a COVID propagation zone. It is not a COVID spreader zone. It's a great place to spend Christmas and the New Year. Be there, but to see these parties you all are organizing there, and we know what you're doing, you are going to be visited by law enforcement along the way, and there must be some way that we can protect ourselves from law breaking and wrongdoing in this country. Enjoy Tobago to the fullest. And those of you who are handling visitors in Tobago, whether you're going to the reef or wherever, you still are required to space people out. You can't just fill up the boat with people and in one another's faces, because you saw what happens. It only takes one person in a crowd to infect a crowd. The crowd infects a family infects a community, and here we go again. So we have to be responsible along the way. I understand that Tobago is expecting a bumper number of visitors this year. We're very happy for that. But please, Tobago is still part of Trinidad and Tobago, and we do not want our Christmas festivities to be the match that starts the next conflagration of COVID in Trinidad and Tobago. I would like in early January to be able to say we had a great Christmas, we had a great New Year, we had a wonderful time in Tobago, and we were in the streets, we were on the beaches, but we come back all as healthy as we could be under the circumstances. So that's very important. And in the shops in Tobago, insofar as you're going doing shopping there, keep your distance. Some people forget and come too close. Gentle reminders would help. And of course, once you're not in the water, keep a mask on your face. Even if you're indoors and you think that you're with people that you have not been associating with, it helps to keep a mask on your face, because it has been shown to work. So there are no changes to be made today to the protocols that we have put in place under law. We continue. I have already extended the existing laws to cover up to January 10th, I think. And the next time we'll interfere with those laws to be from January 10th going forward. So there's nothing to say on that score. The protocols remain in place. And of course, we are expecting the compliance that we committed to. When we started out in January, unlike today, there was no vaccine. Today we have a number of companies that have already been certified and vaccines are being supplied. And there are other companies whose vaccine products are on the way to being certified. And there are a lot of labs around the world that are reporting progress with respect to a vaccine. That is 12 months later. 12 months later. But we now have that position, which we didn't have before, where vaccines are available. Of course, who said life is going to be smooth? As soon as we get the vaccines rolling out, we get the variants, and we now have to confront the possibility of the efficacy of the vaccine not being what it was shown to be at the beginning, because the variants might not be the kind of lock and key arrangements for the vaccine. But we are hoping that that is not so. But again, we have to wait, as Dr. Parson has told us, we have to wait on the labs and the companies to tell us whether we are still in good shape with the vaccines. But certainly science is working. Science is the best basis on which to understand and to respond, because ignorance is never a basis on which to respond, to make the decision. And the world, international bodies, and the business sector of the world have been rising to the occasion. So 1 year after we got onto this journey, we are talking about vaccines now. We are part of the international COVAX group, and notwithstanding the amazing accusation I saw this week that we were being incompetent because we didn't know what vaccine we were going to get. These are just, they're impatient. But eventually we will be told what is available to us, and I suspect that there'll be different brands. We will continue to be responsible. And I want to say that I came out of the village of Mason Hall in Tobago. I think, if my memory serves me right, I was trusting the science since I was 5. Somebody trusting it on my behalf. And then I was in primary school when we got smallpox vaccine. And then as a government minister, I was going to Europe, and I had to have 2 or 3 vaccines, otherwise you couldn't enter certain countries. So vaccinations have been with us, and they have been shown to work. I trust the rigors of the scientific input at the labs and the international agencies that are supervising the work, the ethical behavior, and the scientific numbers of those who put forward the outcome. So when WHO signs off on what is acceptable as a vaccine for the people of Trinidad and Tobago, I would be the first in line to have my vaccine, as long as it is, you'll be second.
I'll be second.
As long as it is signed off by WHO as a scientific product for this purpose, I have no hesitation in taking it myself or recommending it for my family. There's nothing that you can offer to the world that will get 100 support from the human population. And therefore, I would not be fazed by the comments about what vaccines can and cannot do. Understand, the program is meant to breed a new set of human beings who can be manipulated by your cell phone and that sort of thing. I read too much Dick Tracy when I was growing up to allow that to. So that's where we are in Trinidad and Tobago. As soon as we get our vaccines, we have told you what the line is going to be. Our healthcare givers, who we owe a debt of gratitude, and we continue to thank and congratulate, especially at this Christmas time, our healthcare givers will be up front getting whatever we get, because I noticed that even the promised numbers are being reduced as they're being delivered. So I would not be surprised if our first batch is not the percentage that we have signed on for. It will be a part of that. And our first people who are going to get it are going to be our healthcare givers and persons in elderly care residences. And then after that, we'll go down to the ones who are most exposed. And I hope that we will behave in a way that is reasonable, and that is not a problem for us here in Trinidad and Tobago. And we will continue to vaccinate our population. We in Trinidad and Tobago must admit that we have something at this Christmas time to be grateful for. It could easily have been worse. It was not easy, and I dare say it is not cheap. But we have made the commitments, and the output is one that has us where we are today. Not in the best position, but in a very good position. 120 odd deaths, 6,000 people recovered from 7,000 infected, and our parallel system has worked well. Our normal health system is still functioning well, and there are many, many people who cannot say that today. People with far more resources than we have, people who have far more inputs than we have. But decision making is never one option at the level of government. It is always a series of options, and the government has the duty to choose an option, believe in it, and proceed. That is what we have done. I would like Minister Young at this stage to give us an update. Yeah. I would like Minister Young in this earthquake to give us an update as how we're managing on the national security side of handling those who were caught outside when we did close the border, those who live outside and want to come home for Christmas in droves, and where they're coming from or would like to come from, and how we're handling it. Thank you.
Thank you very much, Prime Minister. As I walked up, the CMO was telling me get under the lectern. Okay, thank you very much, Prime Minister. To just provide the population, good afternoon everyone, Prime Minister, Cabinet colleagues, CMO and his colleagues, members of the media, wider viewing and listening public. The exemption statistics, which always put a bit of a smile on my face as I read them. To remind you all, the number of applications we had to enter Trinidad and Tobago as at the 29th of July, our borders having been closed on the 22nd of March, so this is months later, was 5,539. What I can tell you all, and then we had granted at that stage 2,250 exemptions for persons to come in. If we then go to, let's say, the 31st of October as another good date, as at the 31st of October, we had 12,717 applications being made to enter Trinidad. We had granted exemptions to 6,972, so just under 7,000 exemptions. What that showed us is that there was a trend that was taking place at that stage. In addition to those who may have been stuck outside when the borders were closed at the end of March, there were others joining, making applications. We then began to realize by that stage there were those who may have lost their jobs, may have had different circumstances, who were nationals. The Prime Minister has always drawn our attention to the fact that there are 330,000 Trinidad and Tobago nationals out there, passport holders, who have the right to come to Trinidad and Tobago. So by that time, we had that dramatic rise in the number of applications. What I can tell you all, I think when we met on the 20th of November, I told you all the number of applications had risen to 13,922. So that's on the 20th of November. What I can report today is a month later, as at this morning, the 22nd of December, we now have 17,211 applications. Compare that to the number on the 29th of July, and I use the 29th of July number as being a good figure to measure those who were stuck outside on the other side of the border when we closed it on the 22nd of March. As at today, we have 17,211 applications. We have granted 9,557 exemptions to enter Trinidad and Tobago. As at this morning, that has risen, I can tell you, during the course of the day as we deal with more applications. So what we have seen is we've seen this trend, we've seen a number of changes, we've seen the dynamics and categories of persons change. I can also tell you all, added to that are persons who have gone outside, because every time a CAL plane leaves the shores of Trinidad and Tobago to New York, Miami, Toronto, or Barbados, it is going with persons outside. And those persons, knowing that the borders are closed, are now adding to the lines of persons trying to get back in, and we've tried to manage that as well. Of course, we also had the phenomenon of students who wanted to leave in August, and we told them if the borders are still closed, there may be some difficulty. Fortunately, we believed about a month or so ago that we had taken care of the vast majority of our nationals who were stuck outside in March, and we were able to start allowing persons to come home in that category for Christmas. But you all would see, and the numbers tell a story of those increases in those who continue to try to come back in. But added to that are those who have gone out, and I get it, because I get a lot of email and messages of persons, well, I just went out at the end of November, I went out for medical care, I want to now come home. But of course, we still have our prioritization. We have done the best we can. We put on the flights, and I'd like to thank the Ministry of Health, the other arms of national security who helped us to really have good turnaround, and we've stuck to the 10-day periods of being able to bring in flights, turn people in and out of the state quarantine facilities, the state supervised quarantine facilities, and to get that maximum uptake of persons now at just over 9,500 persons that we've been able to grant exemptions to come home as at today's date. There's another issue I'd like to just briefly address. The world saw what was happening, as we were just discussing before here, over the weekend in the United Kingdom. It started off with a promise of a Christmas and then a rollback, and they went up to their top tier where they basically had to shut down and lock down everything in the United Kingdom. Spinning very quickly out of that is what Dr. Paris Ram spoke about, that there seemed to be a variant, a mutation, in my words, of the virus and the effects that had. I looked on with some level of amazement at how other countries reacted to it. We saw some European countries take a decision to say no travel from the United Kingdom for the next 24 hours. Being part of the Prime Minister's team of managing this with our scientists and our doctors over the period of time, I thought at the time, well, that's not much use. But you have to do something, because of course the virus could have already entered, and a 24-hour ban really does nothing, knowing the cycle of the virus. After discussion with the Prime Minister and the Minister of Health, the CMO and his team earlier this week, you all saw Trinidad and Tobago's reaction. We have no direct flights coming from the United Kingdom, so we didn't have to ban any flights from the United Kingdom. What we did is we said, as you all are aware, over the last month, persons coming into Trinidad and Tobago require PCR, a negative PCR test, 72 hours before arrival, really 3 days before arrival. Is not down to the hour and the minute, so it's 3 days before arrival. That remains in place for everywhere, including the United Kingdom. We also then took a decision to increase anyone coming from the United Kingdom, whether they're coming indirectly through another country, they would be required to go into 14 days quarantine regardless. So whereas other persons right now, it's a 7-day quarantine period, you're retested and then you're allowed to go home and complete your quarantine for the next 7 days. Now anyone who has been in the United Kingdom over the previous 14-day period, you're going to, after producing a negative PCR test, be put into quarantine for 14 days, and then we will test you again before you come out of that period. That's our current position. It is subject to change, as you all have seen throughout the management of this. The third issue I'd like to deal with are farm workers in Canada. And again, I smiled as I saw people bawling and screaming, and some people that really are late on the bandwagon, because the government had been working very closely with the government of Canada, and the government's approach has been Ministry of National Security, the Ministry of Labour, who's in charge of the farm workers. We actually have somebody from the Ministry of Labour in Canada as the liaison officer for our farm workers who are outside, as well as the Ministry of Foreign and CARICOM Affairs. And what I can announce today is the last 2 flights that came back from Canada, including one yesterday, we did begin the process of repatriating our nationals who went out as farm workers. There were 2 categories: those who were out before we closed the borders, and then you all would recall there was a large group that were actually threatening to sue the government to go out and work, and we warned them, and at the time they signed indemnity and waiver agreements that they would go out of their own accord, and if they were outside and they wanted to return, they would be subject to the government's border management system at the time. What I can say is the government has been working with the Canadian government. The Canadian government granted them extensions. They set up a specific process to grant extensions to allow our nationals who are outside there working on the farms not to become illegal. And we have now begun the process of full-scale repatriation of those who want to come home, because even in getting the information from the Ministry of Labour and the Canadian government, there is a category of our nationals who are outside that we told them we're bringing everybody home, and I'm about to tell you all the process, but there are still about 90 to 100 odd who said, well, at this time we don't want to come home. Of course, that's always subject to change, as we learned with the category of cruise workers on cruise liners a few months ago. We are having our first fully dedicated repatriation flight of our nationals who are working on the farms in Canada on the 28th of this month, the 28th of December, and we're using a CAL flight, and we'll bring back, I'm hoping, the full amount, 150 workers on that flight. We're going to have a dedicated facility or facilities for them under state quarantine, where we will deal with it and then move very quickly at the end of that 10-day period to hopefully the next flight, which I am hoping would have brought back all of our workers at that time. The government has been working on this for some time. Of course, we were also dealing with all the other statistics that I gave you all a short while ago. If I may just very briefly, Prime Minister, just touch on the energy sector, because we've been managing that very, very tightly. From the word go, the Prime Minister at the early outset had said that we needed to keep that industry up and alive. From National Security, we drove the process. I've been in constant contact with all of the CEOs of upstream, downstream, etc. And it's really pleading with people to follow the protocols. What happened in Perenco was we have 2 categories, national workers and non-nationals. The non-nationals who have to enter the country, we have very, very strict protocols. And in fact, I can tell you all that I've turned away 3 plane loads list of workers who are flying into Trinidad within the past few weeks after consultation with the CEOs of the multinational companies, because they arrive here at Piarco and they did not have their negative PCR tests. And I took a decision after consultation that Trinidad and Tobago, the rules are for everyone, and we were not going to allow a breach, because if people came in positive, they then went out on a rig, they would then potentially infect the whole rig, and that has, so we turned away 3 plane loads of foreign nationals trying to come into Trinidad and Tobago who did not adhere to the protocols. Unfortunately, from what we've gathered with the Perenco incident, it was our own nationals. We've asked nationals who are to go offshore, quarantine yourself before going offshore. Stay away. Stay in an isolation bubble for 14 days before going offshore. Of course, that didn't take place. God alone knows what the persons did, but they took the infection offshore into a rig, and it's very difficult when you're now in that environment, which is a close-knit environment. So again, just to let you all know, this is how we've been managing our energy industry, and we will continue to do so as best as we can. But ultimately, Prime Minister, it comes down to personal responsibility on behalf of everyone. And I'd just like to add to the Prime Minister, my cabinet colleague, and all of the doctors, thank you to all of the healthcare workers, all of the workers in national security, police service or defense force or immigration workers who continue to work all hours of the morning when we have these flights come in, our prison service, our customs officers, and all of the other frontline workers, the fire services who are out there doing yeoman's duty and service. But it really comes down to personal responsibility, and that's the message I'd just like to add, piggyback on the Prime Minister's message and my colleagues and the healthcare personnel, because last night at 9 o'clock, I was the one Dr. Trotman was referring to who went to the grocery, and I was completely shocked, as I was telling the team a little before, to see the behavior at 9 o'clock at night, where I thought it should be a safe period. There was no social distancing taking place. Thank God people were wearing masks. But it really does come down to the personal responsibility. Also, it was my experience of church a few weeks ago, and seeing that people were not adhering to the 50% rule. These regulations have been very thoughtfully thought out, and I'm just asking people in this time, don't let your guards down, and continue to do what you must from a personal level. Thank you very much, Prime Minister.
Thank you very much, Minister Young. I just want to add one line to what you said to those persons who are outside of the country and those who advocate on their behalf. Just remember, we acknowledge the right of every citizen of Trinidad and Tobago to access their homeland, and those persons who might not have been able to come in under the exemption system, it is not that we are denying you access to your right. We are managing the right to life of the people of Trinidad and Tobago, including your own. It's a management issue, because when you come into the country, as you would have heard from all the presentations, what we have done during the year 2020 is manage our exposure to the virus. It is the only thing that has worked anywhere in the world. And in Trinidad and Tobago, we have managed it. That management option that we have chosen here, to close the border and to bring our people in through exemptions, is an option that has given us the best chance to be in the best position under the circumstances. I want to extend my appreciation to all those who manage the system, and also my sympathy to those who were not able to have their family with them, especially those who live abroad and would like to have spent Christmas in Trinidad, because that's the bulk of the numbers you would have heard about there now, that extra 10,000 people. These are largely people who live outside, but for whom Trinidad and Tobago would have been their Christmas choice place. But 2020 is not the normal time where you choose to come home for Christmas and you get to come home. You might have chosen to come home for circumstances out there beyond your control, or because here's a better place to be now. But the circumstances of receiving those large numbers are not the circumstances available to us now. Because could you imagine if we had just left our borders semi-open and those 17 or 20,000 more people had come in amongst us, coming from an area of the highest infection in the world? what would have been our position. So we had to choose options to manage the inflow, and we managed you right up to your management of the incubation period of the virus, that 14-day period. That is the yardstick we've used, that 14-day incubation period. Dr. Parasam and his team, that was our management yardstick and our trading post. And all the management we've done have been around that. And of course, there were fall-off positions with that, there were knock-on positions, but at the end of the day, we can say that we are a lot better off for it. And there are no half measures in this. If we didn't do it properly, you might as well not do it at all. Right? So that's what I wanted to say on that. And I would like the press to ask your COVID questions now, and then we'll draw a line on the COVID. And then I know there are a couple of other things that you may want to end the year questions for me on the governance of the country for the year, and I'd like to take those after. So the floor is now open to the media for a few COVID-related questions, if you do have any of those.
Is a narrative on social media concerning a close family member of yourself and what has just been said about people coming back into the country, a narrative almost as if this person was catapulted to the front of the line of applications. So is there any...
Let me just tell you something. I'm a citizen of this country. I'm proud of this country, and I love this country. It's the only country I have. But sometimes the behavior of some of our own people simply just disgusting. And I, for one, am not prepared to be guided by their level of behavior. Everybody knows from day one, and I've said it from this platform, I'm a father of a daughter who lives in New York, in the middle of New York, when New York was the center of the worst of COVID. And I live with that every night, every day as I manage Trinidad and Tobago's affairs. And it's not a talk, it's a feeling. And I'm insulted at this stage for some nameless, faceless social media creature to be causing you to be talking to me about my daughter getting to the head of the line. No, it wasn't the head of the line. It was the end of the iguana tail. She came home on the last flight that could have brought her home in time for Christmas. No favors, didn't jump any queue, desperately wanted to come home to her family during the year and had to stay right there. And I watched the numbers. And she's in New York, taking the train, taking the Uber, mixing with people in the hospitals, and I'm saying there, but for the grace of God go I. And she has come home to this country among the last. She's been here for how long? I saw her yesterday, close up for the first time. All right? So all those who feel they have a story on that, you're on your own with that.
Prime Minister, if I may, because I've wanted to address this mischief for some time and state here categorically to everyone that at no point in time did the Prime Minister have any conversation with me as the Minister of National Security with respect to granting of any exemption for his daughter. His daughter put in an application like everyone else on the 4th of November. 11th, yes, correct, some time ago, and was in the queue like everyone else. Persons who were looking to come home for Christmas got their exemptions way before her, and the rest is history. But there was absolutely no conversation with me by the Prime Minister requesting anything at any point in time.
And you know why he's able to say that? Truthfully, because I expected this. Huh? I expected that because I know that there are people in this country who would want to make a story an issue of that. So the minister could come and volunteer to you what he's just said as a statement of irrefutable fact. I know my country. Is there anything else on the COVID issue that you want to take? Yes? Could you just identify yourself, please, when we're not hearing?
Mr. Christopher from Guardian Media.
Thank you.
I know the CMO spoke on the new strain that was identified in the UK. We wanted to know if there's any possibility that via the repatriated nationals that there's a possibility that such a strain might have come into Trinidad in any possible way.
Well, I suppose there's a possibility that anything can happen, but because our borders remain closed, because we have managed the repatriation through testing and quarantine, it is hopefully less likely than other countries who have remained with an open border. So we have managed the inflow of people coming from the UK in particular. They would have had to go through possibly Barbados or the United States before getting to Trinidad. So they would have come in that route, and of course they would have had their PCR on the outset, at least 7 days of state quarantine with a day 6 test, again, followed by 7 days home quarantine. So we would have picked up any cases coming from the UK as positive in that cohort, and of course isolated them to prevent any spread further. So we hope that that has minimized the risk to Trinidad and Tobago, significantly so. And we will continue, because we had started the genomic testing with samples in the second phase of this disease, and of course they will test newer samples as well, and we will continue to look and see if we have that variant in our country.
Just to add to that, Prime Minister, after discussion, we also took another precaution with respect to this new strain and virus. The flights would be the persons coming from the UK. I'm certain 95% of them would come via Barbados. The next flight we're putting on from Barbados, you would have seen some other countries stop travel from the UK or slow it down until the 4th of January. The next flight we're going to have from Barbados is the 6th of January, taking us outside of that period as well. The United States has not been permitting persons to travel from the United Kingdom unless it's their nationals for some months now, so that also further reduced the risk. So when we looked at all of that, just to let you all know a little bit of the thinking, and we don't just wake up and make decisions and follow other people, those are also some of the additional precautions we've taken.
Cuba is developing 4 vaccine candidates. And of course, Cuba has been sort of in the forefront of medicine. But of course, global political factors may make the vaccines there harder to achieve certification. Given the fact that the Cuban vaccines will probably be, and I'm just making a guess here, cheaper than the Pfizer and the Moderna and all the others developed in the developed world. Are we looking at the possibility of accessing vaccines there that may be as effective as the others?
Okay, thank you. So that's a quite reasonable question to ask. So let's deal with the issue of regulation, registration first. Any vaccine, any manufacturer from any part of the world could apply to Trinidad through the Chemistry, Food and Drugs Division to register any drug, regardless of its country of origin. The Chief Medical Officer is the chairman of the Drug Advisory Committee, and it can go through that process. On the issue of vaccines for COVID, we have signed up to the COVAX facility. What the COVAX facility will do, because people are asking, why don't we enter into bilateral talks with individual vaccine manufacturers like Pfizer? Without calling Pfizer, any vaccine that we purchase through the COVAX facility, as opposed to having a bilateral arrangement with that manufacturer, is going to be significantly cheaper, because you are pooling resources, and the commitment to COVAX is to sell your vaccines as the lowest possible price. So, vaccine A made by company P, if we had a bilateral agreement, and we had to pay the market rate, let's say it's $100, we could get that same vaccine through the COVAX facility for 1/10 of the price. So that is the beautiful thing about the COVAX facility. It shares risk. You pool your resources for R&D, and that is where we are now. So this so-called delay in getting this vaccine, we can make it work to our advantage on two fronts. One, it gives us an opportunity, doctors will agree, that in real-life testing now, what is called post-market surveillance, where instead of testing it on phase 3, 30 or 40,000 people, you are now testing it on hundreds of thousands of people and possibly millions of people. It means that any potential rare side effects will come out in the wash now. So when we get it in March, we have more safety data to look at. So let's look at this getting a vaccine in March as a good thing. And that's one, and then the price is going to be significantly lower via the COVAX facility. So, to encapsulate, we could look at the Cuba vaccines. They can be registered here through Chemistry, Food and Drugs, and through the regular processes that the CMO is the chair of. But we would prefer a vaccine to be authorized by FDA, US FDA, European Medicines Agency, PAHO, WHO. That will give us a lot more comfort that a vaccine is safe and effective and also cost effective.
Other matters?
For the COVID-like questions, we can go to general questions.
I know you talked about sort of a lot of TDT news. I know you talked about the possibility of students being returned to schools by mid-January, late January, and so on.
With a huge caveat.
Yes, but
don't just say I've said children can return to school. The reference to school is an objective, which I said if we are able to do that, it will be a giant step forward, and I'm hoping that we will be in a position to consider some interaction in schools with students, and that would be entirely dependent on the status of our health and COVID infection levels.
Is there any consideration to, let's say, when the vaccine comes in March, late March, to have some of the population vaccinated, then to consider that aspect?
Well, if you look at what is happening, if we begin, let's assume that the population begins to be vaccinated in March. And if we do, we're not going to wait, if the numbers are good, we're not going to wait for the vaccination to begin to bring some students out. If the numbers are not good, we certainly will not expose the children to an unvaccinated population when a vaccine is around the corner. So those are the considerations. As Minister Young said, we have to keep making changes to suit the situation. So I don't want to hold out something now, not knowing what the situation is going to be at the time horizon that you're looking at. Let's see what happens in early January after Christmas. Right now, our biggest target is coming out of Christmas without a national irresponsible zone. If we get that, and then Dr. Hines is reporting to us after he do his 7-day check in end of January, second week of January, that will show up. If Christmas, New Year was bad, it will show up by the first week in January, and it will peak or be accelerating in the second week of January. When we look at those curves, we will know what we're facing then. And the government will then have to take a decision. What do we do with school children in this school term in this situation? And a decision would be made then. If the decision to be made then is such that we could say, yes, we can bring some children out, that will be a good place to be. If on the other hand, it is that we are worried about what happened at the end of the year into the first week of January, then we'll be saying it's not a good time to bring the children out. And then, of course, we don't know. Suppose the report that comes in from the labs is that the variants are not responding to the vaccine. We're back to square one. But we're hoping that the science is such that even if that is the situation, that some tweaking of the RNA works in the lab could allow us now to respond more quickly with a vaccine, even if the virus is changing its form.
PM, if you don't allow me to support what you are saying about schools, and I just want to alert the national community of this. We at Health are being, I like to use Minister Young's words, bombarded by the owners of water parks to open up water parks. Ask yourself the question, who uses water parks? Children. These are the ones who want to go to school. If we are to fulfill the Honorable Prime Minister's objective of having children go back to school for all the right reasons, we have to keep water parks which are frequented by children to make sure our children don't get infected, infect each other, and then schools can't open. So we have been bombarded by requests to open the water parks in Chagaramas, in Debe. We just can't do it at this time because we want to keep that population safe, the same way we are keeping our elderly safe in our long stay homes. Okay?
Thanks. Okay, that's it for COVID.
You had met the Venezuelan ambassador recently. So is there any update? And then do you have any response to there was an opposition criticism saying that why should a head of government meet a lowly ambassador? There was a criticism yesterday. Any response?
I met with the ambassador yesterday. And not yesterday, sometime during the week. And let me just, it's all in the day's work, eh? So, because the government of Trinidad and Tobago is required to talk to the government of Venezuela and all other governments for that matter. And for those for whom that is a problem, they had just hard. They're not learning. I pointed out to you all, there was a general election due here in August, it was called in August, but it was due in 2020. And one of the biggest events that took place in this country leading up to that election was the opposition asking the Americans to sanction Trinidad and Tobago and to sanction me and my ministers, named ministers, for allowing Delcy Rodriguez, Vice President of Venezuela, to come to Trinidad. And that was the biggest attack on the government by the opposition leader, because we had violated American sanctions, and by now you all knew the name of the plane, the plane serial number, and who was on the plane and all that, and behaving as though we had hidden to do something. And I had to point out to you all last week that the Africa, Caribbean, Pacific study on Trinidad and Tobago made a specific recommendation, as if we needed that, to tell us that to manage this migration problem between us and Venezuela, that we are to be in constant communication with the source country. But yet you have people in this country telling us, don't talk to the Venezuelan authorities. And who are the Venezuelan authorities? You have an opposition in Trinidad who is telling you that the Venezuelan president is a fellow called Juan Guaido. Talk to him. And do not talk to those who are at Miraflores in Caracas. And of course today, where did we end up? We end up with the opposition in Trinidad and Tobago driving the foreign policy of a foreign government against its own government, undermining our foreign policy, joining with people outside to attack the government of Trinidad and Tobago for doing what the government is supposed to do for the people of Trinidad and Tobago. Well, let me say this to you, Mr. Douglas. You see, all that, it comes to this government, we don't ignore it, but we are not guided by it. It's as simple as that. We are not guided by it.
The Court of Appeal yesterday gave a ruling which for many people may lead to an opening of the floodgates with respect to having a wave of children of registered migrants being able to come across the Trinidad and Tobago and at least have an injunction until whatever constitutional matter is heard. What is the government's response to that, and what is the government doing to prevent a possible waiver in the interim?
Well, the government of Trinidad and Tobago, contrary to the impression that was being postponed and nurtured by some people, we in Trinidad and Tobago, we observe our laws, we respect our courts, and we comply with our courts. You would have observed that every time anybody goes to court suing the government for all manner of evil, the government turns up in court when we are allowed to and when we are informed. Because some people have gone behind our back, ex parte, and get judgments, get decisions against the government. But every time anybody goes to the court in Trinidad and Tobago, the government turns up in court with lawyers, properly briefed, to argue for the interests of the people of Trinidad and Tobago. Not the government, not for the government or the political party in office, but for the people of Trinidad and Tobago. And when we do that, we abide by the rulings of the court. What happened with that child is that private interests ran to the court and made a case against the government as though the case had been made against the government. And the judge who has been now ruled upon by the appeal court took certain breadths of descriptions, and that's a matter for the judiciary. We're not going there. The bottom line is the substantive matter was on filing, a matter that the government was responding to appropriately under the laws of this country. It is still to be dealt with. The judgment now says it must be dealt with by another judge. So it is still as it was in the beginning, it is now. Let us wait and see what the court says. What I do hope and I genuinely expect that those who are making decisions in the judiciary are seized of the sovereignty of this country, of the laws of this country, and the interests of the people of Trinidad and Tobago. Because they live here, their families live here, this is their country, like my country, like your country, and the laws are meant to protect us, first and foremost, as we take our place in the world. So that is, let us see what happens in the court. But the one thing for sure is that the narrative that the government was acting illegally and is a renegade government, breaking international law, that has been sufficiently debunked. And in the court, you will always see the government there at great expense. Because what you all don't know is the millions of dollars that it costs for the taxpayer to go to court to fight those cases. And when the state wins, we don't get to recover. When the state loses, it's a bonanza for lawyers who troll with the other bottom feeders there.
But, okay, the fact that you talk about the laws, and I just want to find out.
It can only be the law.
Fair enough. Are they, is there a weakness? Does the government need to make the law much clearer?
If there are weaknesses in the law, then that's a matter now for the parliament and the government. And I'm not here speaking to any specific issue. It's a process. If the government sees loopholes that are exploited, and that's how it is, in every aspect of our law in this country, if a loophole appears, the government will seek to cover it, to close it, so as to get the benefit of what the objective is of that law. So if we have to, and I did say the other day when I spoke on this matter, that we are well advanced in bringing certain changes, but the changes may not be what some people would like it to be to facilitate this flood that you're talking about. It will really be a tightening of a situation to protect the people of Trinidad and Tobago from an environment where that flood that you're talking about may be our portion if we're not careful.
Is the government here, for example, in tightening the law, to consider making it an offense, a punishable offense, for people to provide employment to unregistered?
Well, I would not. I wouldn't want to jump ahead of the Attorney General here, because we'll have to have that in the LRC at Cabinet. But for sure, trafficking in persons or exploiting migration issues for benefit to the detriment of the country is something that we wouldn't encourage. But how that will take its form in law, in legislation, is another story. I wouldn't want to speak to that now. But we certainly are going to make it more unattractive, I think is the word I've been using. We'll make it more unattractive for people to engage in bringing people into this country illegally. And if you're bringing people in illegally, and one of the outcome of that illegal entrance is using them in the workplace in a particular way, then of course in a civil society, a normal society, there ought to be laws against that. So that's how it's going to go in the discussion. That's going to frame the clauses of those laws.
Because I noticed you last week, you talked about push and pull factors. So, looking at some of the pull factors.
Pull factors? Well, I was hoping that by now you could have told me where $11 million was going, because that's a huge pull. If there's $11 million in Trinidad and Tobago to support migrants coming here, as the head of the government of this country, I would love to know who's getting that money. And I'm awaiting the answers to that, because it will tell me what exactly the strength of the pull factor is.
So that 11 million goes to other organizations?
I have no idea. Like I read it in the papers like you. So it has raised certain questions, and we await the answers. Who is getting that money?
And the one final question on this issue, and it may be for the Minister of National Security. If we do have a situation where once people get to our shores, they have the right, well, it appears that there are lawyers waiting on the shores to go to court, and they do have the right of access to the court, then it means the only way to address that is to catch them in the water, so to speak. And is the Coast Guard on a regular basis doing enough? Because we hear the vessels are down and all of that.
Let me just say something. This issue is a broad spectrum. You probably would have seen it in text, some reference to something called non-reforma, used by those who claim to be experts in international matters. You know what that means? It means once a person is on their way to your country, you can't turn them back. And there are people asking us to accept that. So once you shove off from anywhere and Trinidad is your destination, there ought to be an acceptance of that migrant. There might have been times in the world, or there are borders in the world where that is probably the most humane thing to do. But there are places and times when that is not the most sensible thing to do. And that's why I'm saying we are not following fashion. So I just wanted to mention that to you. And the requests that we are getting are requests to do some things, some of which are clearly not in the interests or the laws of Trinidad and Tobago.
Thank you very much, Prime Minister. Just to put things in context, I had a press conference about a month ago where I was very careful in setting out that we are applying the laws of Trinidad and Tobago. So that's the first point I'd like to make. And the Court of Appeal, no court has ruled on that as yet. The current immigration laws are in place. They are being enforced by Trinidad and Tobago. We do have the right to deport persons who have breached our immigration laws. I want to remind everyone that the borders of Venezuela are closed on their side in law. The borders of Trinidad and Tobago are closed on our side in law, and that is in addition to the regular immigration matters, including now the requirement for everyone to have a visa. No court has said that none of our applicable laws, or none of our laws are applicable anymore, or no longer applicable. I have been observing this thing for a while, and I'm asking the media, look around the world. Just last night I was reading a report in Greece. Countries around the world, I keep telling you all this, once they have a maritime border, the United Kingdom in the past few weeks have had to put their Navy out, their Coast Guard out as well, to prevent migrant patterns and persons coming across. People still get through. So even in Greece, the whole south coast of southern Europe, which faces northern Africa, they are all having similar problems. So to continuously say, is the Coast Guard doing enough? My answer is the Coast Guard are doing all that they can, and I stand with the men and women there, with the assets that we have. But when you go out on a maritime border, as the Prime Minister and I were discussing, I think it was on the weekend, if you go and stand on a vessel, even our larger vessels, and you look out 500 meters, depending on the choppy water and sea, you're not going to see a pirogue. 500 meters ago, I took the media out on a tour on one of our vessels not too long ago. So the Coast Guard are doing all that they can. We're using coastal radar, air assets, everything, and they will continue. Does that mean that vessels wouldn't slip past? The answer is no, it doesn't mean that, as we're seeing. But then also caution to those who are encouraging it. And as I was telling the police again today, there's a law of aiding and abetting. So if it is obvious that there are persons who are aiding and abetting in illegal migration and the breach of the laws of Trinidad and Tobago, transporting in vehicles on the road, you pick up a vehicle, a busload of illegal immigrants, non-registered, that is against the law. Persons who seem to have better information than the state, even before people arrive, or in a court saying that, well, the vessel is still out at sea, or I was shocked when I was in a court hearing at Sunday night, 8:30 in the night, to be hearing persons in the court professing to know exactly where the vessel was outside of the waters of Trinidad and Tobago. I asked the question, how is that possible? Are persons engaging in aiding and abetting? They're definitely aiding and abetting in human smuggling. Is it worse than that in terms of human trafficking? So we will continue to do all that we can. As a state, we will continue to fearlessly uphold the laws of Trinidad and Tobago, and I give that assurance.
Let me just say something. You all would have heard me talking about, and we are in anticipation of the arrival here sometime early next year, our first Coast Guard cutter from Australia. It's called a Cape Class vessel. You know why it's called Cape Class? These are vessels designed specifically for this purpose, which is to patrol offshore at distance with long endurance, mainly for migrant management. The north of Australia, the Cape of York, that's the peninsula at the top of Australia that faces the Pacific Island nations. And they have the same problem there that we have here. We live on a little island where our migrants are coming from a continent. The Australians own a continent, and they are holding their line against islanders coming to them. And these Cape Class vessels are deployed in the waters north of Cape York, which are pretty rough seas, very much like our East Coast seas here. They have an endurance of a month. They can go out to sea and be out at sea for a month. Right? One of the features you will see on that vessel is an ability to hold people. And the Australians are out there stopping people from coming into their shores, stopping them away from their shores, and using a variety of methods and methodologies to protect themselves from waves of migrants. Nobody in Trinidad and Tobago who is attacking our government or within a region is putting a finger on Australia and saying that Australia is being inhumane and Australia is being pillaged around the world. They're doing it to us simply because we are small, and simply because they believe we can't defend ourselves. But we have been defending ourselves in the principles of our laws, the sovereignty of our nation, the interests of our people, and the general common sense and good sense and good nature of the people of Trinidad and Tobago. And that's why we listen to all of them. But as I said earlier on, we hear all of it, but we are not being guided by it. Thank you.
I had a similar question to what Ray had asked. As you mentioned that there would be an adjustment of the laws for nationals, I was more focusing with regard to the migrant policy, if there will be any adjustment to that considered as well.
Well, we have a migrant policy. Some people don't like it, but we have a migrant policy. It can be changed, improved, tweaked. We can add to it, we can remove from it, but you have to respond to situations. The last time I spoke here, I mentioned to you there's a big difference from a practical standpoint, from an interpretative standpoint, between designating a person an economic migrant an asylum seeker or a refugee. It all depends on the designation. The person's circumstance allows that designation to be made, and depending on what you say. There was a gentleman here who made a lot of your news a while back, who had a big file in the police headquarters, the police service, and under police interest for murder. The next time we saw him, he was in the UK seeking asylum from Trinidad and Tobago. He's still there. I, as Prime Minister, headed the National Security Council. I have to read that in the papers. And I know personally that there's a witness in Trinidad and Tobago who came to a minister in my government to offer himself as a witness and needs protection with information about a murder in this country. And the next thing I know, we are being accused in Trinidad and Tobago of being the worst, and the man can't live here because he can be murdered for his sex life. The world is not going to give us a pass, you know. We have to manage our own affairs here. And I keep saying to the people of this country, whenever you get to the position of national security chairman in this country, you know a little bit more than most people in this country, and a lot of it you can't say. So those are the realities. But what we do, we ensure that every decision we make, we put the interests of the people of Trinidad and Tobago first.
Can you say how you find your Christmas?
Oh, yes, I have a stack of books. For which I'll be on 5 very important reports that I have to deal with. I have a report on WASA, I have a report on Lake Asphalt, I have a report on digitization, I have a report on, what's the other one? I have 4 governmental reports which I tend to study over the Christmas season along with my books. I'm spending Christmas with my family in Trinidad. I'm very, very pleased, happy that my daughter is home. So we're going to have a very close family only. So you might hear from me, but you won't see much of me. I'm not visiting anybody. And if you think about visiting, please postpone. And I will eventually get to Tobago for the New Year, as I've been doing for decades. I would love to be in Tobago. I hope things are such that I can get to Tobago for the New Year. Spend some time with some semi-isolation in a different atmosphere in Tobago. And the next cabinet meeting would be on the 7th of January, possibly in Tobago, because I might, not confirmed yet, but it might be. But so that's a very, very quiet family Christmas I'm having, to answer your question. And I want to thank all those thousands of people who throughout the year prayed so ceaselessly for me, my family, and this country. And all those of you who take the time out from time to time to send your good wishes by WhatsApp and just to let me know that you're there when you see the most ridiculous things being said and done, that you identify yourself saying, hold on. It really means a lot to me, and it allows me to face the waves and the slings and the arrows. But it comes with the territory. I'm not complaining, but I'm really appreciative. And I would like to advocate that we continue to be our brother's keeper. And I want, on your behalf, every citizen of Trinidad and Tobago to give a very special thank you to our protectors in the public service of the healthcare department, national security, and other departments that have kept us safe during the pandemic year of 2020. It appears as though 2021 will have a significant component of this pandemic. So it is not over. It may be far from over. So let us not get tired. We have a song that we sing, we never get weary yet. We can't get tired fighting this pandemic. Thank you all very much, and have a very Merry Christmas, and let us look forward to a much better and a new year that we can discuss later on as bright and prosperous. Thank the media. We don't always get it very correct, but there's only one version of correctness. But you've done a really good job in keeping the public informed during this pandemic, educated. We are much better educated now, and I would like to ask you to continue to be responsible, to continue to educate, to continue to cover, and let us be reasonable. All we can ask of you is reasonableness and professionalism. Have a Merry Christmas, you and your family. Thank you very much.